I would like to point out that we also can't get this done unless we have support at the national level, and we have that support. So Congresswoman Pramila Jayapal this year worked really hard to put together a state-based Universal Health Care Act of 2018 to be able to alleviate federal funds for states that want to innovate. And I am so proud that we have a representative in DC who is willing to work for us. I am so proud to call myself a constituent of Congresswoman Pramila Jayapal. Please come up here and talk to us. Thank you so much.
Thank you. Thank you, thank you, thank you. I am so thrilled to be here with you, and I just want to say, Healthcare for All Washington, you are it. And to have the first annual gala, Bevan, thank you for your incredible leadership. Really, you've just been so inspiring to watch. You're an organizer, you're a strategist, you are a smart and savvy political advocate, and we deeply appreciate you. Marcia and the board, thank you so much to all of you, and the organizations in the room that have been friends and advocates and allies alongside as we've pushed for so much change in the city, in the state, and at the federal level. I know you have been working really hard, and I deeply, deeply appreciate it. And yes, I am proud to represent Seattle in the United States House of Representatives. And I'm proud also to come from a district that has so many incredible state legislators. You just heard their names, but these folks are incredible. They are driving at the state level to innovate around healthcare. And I have to give a particular shout out to my friend David Frocht, who you're going to hear from. But I really miss him. I miss sitting next to him, and we text each other sometimes when I'm in Judiciary Committee, because he's probably the only person I know that actually watches C-SPAN all the time and watches all those committee hearings. So it's been one hell of a time in our country fighting for the soul of our country, really on every single front. And there are so many people in this room that fought very, very hard when President Obama was in to try to get a single-payer healthcare system. And we all understand that the Affordable Care Act did move us in a big direction, covering tens of millions of people across the country. But to me, perhaps what the Affordable Care Act did that was most important is it reminded people that actually healthcare is a right and not a privilege. And I think that before the Affordable Care Act, we didn't have everybody in that place. But once we started saying, you know what, if you're a woman, that should not be a pre-existing condition. And by the way, if you have a pre-existing condition, you should be covered. And by the way, kids should be covered. And everybody, if you're poor, you should be covered. That is what the Affordable Care Act kind of put us on the path to having Americans realize, wait, we can have these things. And now all of a sudden, coverage of the kinds that were included in the Affordable Care Act are assumed to be what we should have. So it took us that step forward, and if you look at the polling, you see this giant sea change, right? People didn't used to think about healthcare as being a right and not a privilege, but today they do. The majority of Americans believe that to be true. What we also know at the same time is that there is nothing contradictory about fighting the Republican efforts to dismantle the Affordable Care Act. We have to fight that, because it is just putting people further and further down. But at the same time, fighting for that single-payer universal healthcare system that every industrialized country in the world except the United States has in place. And that is, I think, that is the work that is in front of us now. We have 100 and, I forget what the number is, 22 or 23 sponsors of HR 676, which is John Conyers' original Medicare for All bill in the U.S. House, and in the Senate, she's got her 676 sign there, and in the Senate, more senators that have signed on to Bernie Sanders' Medicare for All bill than we could have ever imagined, including all of the presidential contenders that are running. Why? Why is that? if you read the Washington Post and the New York Times, there are all these articles. The New York Times just interviewed me because Seema Varma, who is the Medicare Human Services, I forget what her title is, but she's a Trump administration secretary. She said, this is a crazy idea. Medicare for all is a crazy idea. Well, no, the reason they are attacking this is because they're afraid that we're right. They're afraid that the majority of Americans across the country actually believe in Medicare for all. And that is not just in liberal progressive districts like this one. Thank you, by the way, for being one of the most liberal progressive districts in the country. It is actually true in swing districts. How do I know that? Because I got elected the first vice chair of the Congressional Progressive Caucus, 78 members strong, and the largest values-based caucus in the House of Representatives. And I decided that we needed to do a poll in 30 swing districts across the country to test some of these ideas that we say are progressive, but in fact, I believe that independents, Republicans, and Democrats in swing districts support. And you know what we found? We found that independents and Republicans and what we call progressive surge voters, these are base voters that we really need that frankly lost faith in Democrats for a whole bunch of reasons. We found that these policies like Medicare for all and college for all are actually the same policies that independents want and that progressive surge voters want. People want bold change. They don't want incremental change. Why? 60% of Americans today do not even have $1,000 in their bank account. Just think about that. 60% of Americans today do not even have $1,000 in their savings account. So the reality is we need to do work that is going to move people a vast distance, not just a tiny little place. We don't just want, $5 more. We want health care so that no American is ever one healthcare crisis away from bankruptcy. And that is what you are fighting for. So there are two things. Bevan mentioned the state-based universal health care bill that I introduced, and many people in this room and this coalition, Bevan and all of you, were so essential in giving us feedback on that bill. This was the bill that Congressman McDermott had introduced before. I know David Loud is somewhere in this room and worked on that bill and was a huge asset for our office as we thought about how do we restructure that bill so that it addresses the issue that was there before, which is that Republicans are trying to move to this, basically take whatever federal dollars there are and then provide less than good health care in their states, right? That's part of the plan that they're pushing. So our bill has a lot of protective measures in it, and many of you helped to design that and gave us feedback on it, but it essentially says that this is about health care that is for everybody, so you've got 5 years to cover 95% of the people, and then you have to cover the remaining 100%, the remaining 5% in another several years, and it allows for states to band together. So if California, Oregon, and Washington wanted to come together and use these federal streams to move to a single-payer healthcare system, then you would be able to do that. So it gives you the federal dollars to be able to do that. So that complements the work on the state-based bill that David and Noel and Javier and others are helping to lead on at the state level, because you got to have federal funds. Otherwise, it makes it very, very difficult for states to do what you need to do to move forward. The other thing I wanted to just close with is I also just co-founded the Medicare for All Caucus. With Keith Ellison and Debbie Dingell, and we have 76 founding members of the Medicare for All Caucus. It is one of the largest caucuses in the House, And it has caused a huge splash, and everybody is like, oh my God, what does this mean? What it means is we are on a path to getting a real bill that can be implemented, and that we bring the caucus on board, that we share information, research. We've already had one briefing. We had 60 staff members from different offices at that briefing, because what we're trying to do is answer a lot of the questions that even some Democrats have who have signed on to 676, and make sure that we have real champions for moving a real plan forward, because the reality is the United States is far behind every other industrialized country in the world, and healthcare costs are killing people. The high cost of pharmaceuticals, the unnecessary tests. A Medicare for all single-payer system would save taxpayers billions of dollars, because you would get rid of all of that unnecessary stuff that is happening right now with the drug manufacturers and with the insurers and many others. So I want to say thank you so much for continuing to put us on that path forward, for continuing to organize, for continuing to build the movement. I can tell you that in the 2020 presidential election, mark my words, Medicare for all is going to be one of the defining issues of the 2020 presidential. Thank you all so much, and have a great night.